Bill.
Hello, hello.
Man, thank you for being here.
Hey, thank you for having me, and I appreciate you.
No, I'm excited to do this, and I appreciate everything that you and CFGC do. So thanks for taking the time today.
Thank you, and thank you for all the help that Brick by Brick gives us as an agency. We appreciate that.
I'm happy to do it. Now I got to jump into my cheesy intro. Hello, everybody, and welcome to Brick by Brick, the community podcast where we build community one conversation at a time. Brick by Brick.
Growing community, one conversation at a time. Brick by brick.
What did the organization look like at the start?
Oh my gosh, we had one wing. Well, when I started there, one wing. I think there was maybe 10 therapists. We had a medical director. We were very small, so everybody wore a lot of different hats. We all did a lot of different things. It was a very tight-knit group of people. We had a lot of fun together and really just came together to deliver good services to our clients and our families. So
we have stigmatized mental health and mental health issues as being something that we don't talk about and we don't want to address.
Children's mental health is a big deal. I think that we should worry about our kids. They're not asked to be put into the situations that adults put them in. And so this is how we can all help them. And to me, that's huge.
It's more of one of those things where it's unless someone reaches out to you, you don't reach out to them.
Right. How long ago was it when you were a client?
I was 8 or 9 years old.
Okay.
Our neighbor was shot. So my younger sister and I witnessed the aftermath. And so I don't know who, somebody referred my mom to CFGC. I remember getting to the Brown building. That's how we knew it, the Brown building. And even as an adult, I would say to my sister, I wonder if what's going on there still, because the building is still standing.
I think kudos to your parents too for like seeing that as a value and kind of, I'm sure they drove you and facilitated that.
Well, and in the Latino culture, you don't talk about mental health. That's
Right.
taboo, right? You get to a point in your life where if people don't hear that there is success that can come from it, or don't hear that it works, and when I say it, I mean therapy, support does work, then they don't give it the value that it does need.
Through these conversations, what I hear a lot of is the importance of destigmatizing mental health.
I don't think I would have actually gone and met with a therapist had I not committed to this role, in the sense of saying, okay, if I'm going to do something, I'm going to represent it. I have to be willing to go cross that door as an adult, right? Who has a child on the way, and I'm going to have to face the music with this. But man, dude, did I learn all this stuff. And it helped me give my dad the empathy that I needed to get past it and to love him again. And to this day, I'm still trying to get him to go to therapy too, because he needs it. And I think all of us do. And this is why I care. This is why I give back. This is why I'm involved. This is why I donate to the organization as well. I'm there because I see the families that walk through our doors that are seeing their therapist, and I know that we're changing lives.
Do you love what you do?
I do love what I do. I can't imagine doing anything else. I've thought about that like along the years, but I can't imagine myself doing anything else.
What's one of the biggest changes you've seen in the organization since you've been there?
Wow, that's a really, really big question. There's been a lot of changes. I mean, over almost 30 years.
Right.
Growth, I would say, would be one thing.
our sites have grown, our program, our funding has grown, our reach has grown.
So yeah, we're healthy right now, and we're healthy financially. We always need more because the need is always there, but we need to grow our capacity for sure, because every year we're having to close down our intake lines, which I do not like to do, because that means there's a kid out there that needs help, and we're not be able to help them because we don't have the funds to do it.
We usually serve approximately 400 to 500 children, but we're getting to capacity. And it's sad when you have to hear that we had to stop the hotline and you can't continue to help. The need isn't getting less.
I think that the issues that kids struggle with now have gotten really big.
Back when I started, our intensive cases were more what we see on our non-intensive program now. So there's definitely more of a mental health need out in the community.
Well, obviously, we take care of the mental health of the children, but we're also looking at the whole need. We're doing a lot of service in homes nowadays. So when we go into the home, we might identify a need in there. And we have a notebook this thick that we can refer people to get that help, or we handle it ourselves.
It's all about having that support structure. And that's what we do at CFGC. We get them the support that they need. We put them in touch also with other organizations that are doing other parts of the community network, right? Whether they need shoes, clothes, food, we provide that. We help them with that. It's full case management. We have what's called a service access team, and they assess all that situation. On top of that, our therapists are going into their homes, providing therapy in their environment, and they can assess what else is needed, what else is going on here. Because how do you help someone through a mental health challenge, right, if they're hungry? We're in a pivotal moment where we are leveling up.
This next step that we've taken with actually purchasing a property, which has been our goal for as long as I can remember.
We have space. We can do groups. We could look at drop-in centers. We could look at food shelter or food supplies. There's a lot of different things that we could think about doing that we haven't had the opportunity to do before.
What does CFGC mean to the community?
A brighter future for the young people who need support.
It means our future, helping kids.
Well, that there's actually an agency out there that no matter what your funding is, or what insurance you have or don't have, that you, when your child is suffering and when you're suffering, you have a place you can bring the family to.
What does Community Family Guidance Center mean to you?
Community Family Guidance Center means that my mother would have gotten the help she needed when she was a child. My mother, unfortunately, was kidnapped and suffered a lot of repercussions from that. And I know to this day that her life would have been a better life if she had been able to reach someone like Community Family Guidance Center to help her. Sorry.
No, that's all right.
Yeah, and so I think that's what it means to me.
Beautiful.
Community Family Guidance Center, we're fortunate to have a really good contract with the Department of Mental Health, which we've expanded and we've done great things with it, but it's limiting. We can only do so much with it, right? And on top of that, they tell you how you can spend it.
Right.
So, I made a decision many years ago. We got to change that. We got to get some other funds in here so that we can do what we need to do overall for the mission. So we've really worked hard on that, and we've done a pretty good job at doing that. And I'm happy to say that we're doing other things than the DMH work nowadays, and it's awesome.
So you kind of had to go outside the box a little bit?
Yes, absolutely.
Are you an outside the box thinker?
Yeah, I like to kind of look at things and say, okay, what if we did this and move this around and did that?
When somebody donates to the Community Family Guidance Center, where can they expect that money to go?
Well, it can go a number of different places. One, it can go to help a child or a family that's uninsured, and to get the actual direct services. But another important place it can go is actually into our therapy rooms, into our waiting space, so that we're creating a space that is safe and warm and welcoming and respectful, because we're community mental health providers. So we're not some ritzy Beverly Hills, place.
We're on the podcast right now, but we're actually at the event for the 50 years right now. So talking to the audience, what's your message to them? Actually, they're right there.
Give as much as you can, even if it's not hard dollars. You can give monthly. I can't afford a lot, but Victor debits my credit card every month.
You can't go wrong giving to CFGC. We are fiscally responsible. We do what's right by these kids, and we put as much into actual services as possible. We keep the overhead low because of that. And our mission is just that. It's our mission. We are mission driven. So you're given into a really good place.
What is your message to everybody in attendance?
The funds we get from the county, although very, very important, are never enough. And in order to really function appropriately, we actually need donations to hire the best therapists and to provide the best program we can.
One of the keys is to know that you have funding that you can count on a monthly basis, on a yearly basis, whatever. So one of the keys to us being able to know how much money we have that we can spend, it's through a monthly giving program. So contacting the Community Family Guidance Agency, they make it very easy for us to do automatic giving on a monthly basis, whatever you want to do.
We've got excitement, we've got desire. We have the ability to provide in a deeper way to the families that we work with, and we need your help. We've had your help, we've appreciated your help, and we need your ongoing help.
The need is there, and so it's important to fund this agency because the need is there.
Well, thank you for everything that you do with the organization, and you as an individual. You make a huge impact on the community as a whole, and everything that you do. So thank you from the bottom of my heart, and to another 50 years.
Thank you, brother. To another 50 years. Appreciate you.
All right, get out.
All right, let's go.